Dr. Moses Masekwe, our keynote speaker. He's also the country director of TRAC. Dr. Olu Olushai, the acting deputy representative for Liberia. The chairperson or delegate of the Superintendent Council. And then the chair of the CHOs. That would be the CHO of Montserrat, Dr. Joel Foley. Okay, so just some quick ground rules. How to ensure that our phones are on silent. It may not be intentional, but let's just make sure that that is the case now. And I've just been informed that the washroom is straight ahead, so that will be easier to back. So good morning, members of the higher table, partners of the Liberian health sector, leaders at the national and subnational level, distinguished ladies and guests. So I'd like to officially welcome you to the National Health Summit under the theme, Unlocking the Potential for Improved Health Outcomes, a pathway to maternal and neonatal mortality reduction. Over the next 3 days, we will review our national performance. We will examine our collective challenges. We will highlight innovations. And we will set bold, evidence-based directions for improved service delivery in our country. This summit offers a platform for us to evaluate our performances, understand what is working and what needs to be worked on, share our lessons and our innovations, and commit to clear, evidence-based recommendations as to how we move forward. And so without much ado, I would like to call any member of our distinguished body to please offer the opening prayer.
Let us all bow. Our Lord and our God, we have come this far to say thank you. As we are about to go into our discussion, we pray that you be in our midst from the beginning to the end in Jesus' name.
Amen. Thank you. So we're not called Honorable Martha C. Morris to officially welcome us and to set the tone for the day's engagement.
Good morning, everyone. Honorable Dr. Louise M. Kuto, Minister of Health, distinguished stakeholders and partners, healthcare professionals, ladies and gentlemen. I'm honored to welcome you all to this particular health summit on the theme, Unlocking the Potential for Improved Health Outcomes, a pathway to maternal and neonatal mortality reduction. This gathering represents a critical moment in our collective quest towards addressing maternal and neonatal mortalities. as we will be reviewing performance of the health sector, sharing best practices, documenting challenges and lessons learned to proffer recommendations that are aimed at improving health outcomes. At this juncture, I would like to recognize and commend our exemplary leadership of the Honorable Minister of Health, Dr. Louise Mablekoto, for unwavering commitment, visionary policy making, tireless effort, and dedicated to strengthening our healthcare system. Under her leadership, we have witnessed notable strides towards equitable and accessible maternal and neonatal care, setting a benchmark for health innovations, collaborative efforts, and inspirations for the entire health workforce. Therefore, these efforts have not only saved lives, but have also demonstrated that with determined leadership, meaningful changes are possible. A special thanks go to our frontline workers, the CHOs, clinical and support staff, which through their dedicated services and implementation of health activities, we have experienced some changes in the health sector. As we embark on the summit as health professionals, stakeholders, partners, advocates, let us be open-minded in our discussions, explore actionable solutions, leveraging on the available resources, expertise, and partnership to addressing maternal and neonatal challenges that will carry the momentum of today into sustainable actions for tomorrow. Once again, welcome to this critical health summit, and I encourage us to leave from here inspired, empowered, and encourage us to leave resolute in our commitment to unlocking the full potential of our health system. For the sake of our mothers, our newborns, and future generations. Thank you and welcome once more.
Thank you so much, Dr. Gavin. We will now call on Dr. Tapek Koli. Dr. Joel Tapek Koli will now give a statement on behalf of the Council of Officers.
Dr. Louise Mablekoto, Minister of Health, Republic of Liberia, Dr. Catherine T. Cooper, Deputy Minister of Health, Chief Medical Officer, Republic of Liberia, WHO Acting Representative, Chair of the Superintendent Council, health partners, members of the county health teams, directors of the Ministry of Health, Deputy Ministers, Assistant Ministers, fellow colleagues, distinguished ladies and gentlemen. On behalf of the county health teams, we want to say thank you for inviting us to to this important forum, the first National Health Summit of Liberia. As county health teams, we serve as the direct implementation arm of the Ministry of Health. And in this slide, with your support from the ministry and partners, we are committed to providing quality and equitable health services to the population of Liberia, particularly improving maternal, newborn, and child health services. Someone will ask, why maternal health? Maternal health is one of the cornerstones of public health, and the health of a woman during pregnancy, labor and childbirth, as well as postpartum period, affects not just the mother, but also the unborn. As we are all aware, we all came from somewhere to where we are today. And if anything happened wrong along the line during pregnancy and childbirth, we wouldn't have been where we are today. The healthy pregnancy leads to a healthy baby. And as we reflect on this theme for all the 3 days theme of the Health Summit that says unlocking the potential for improved health outcomes, focusing on maternal and newborn mortality reduction. This is a call to all of us, not just county health teams, but other partners, community members, health organizations that are supporting health, that will all come together to work collectively, that will ensure access to quality maternal child health services. This means that we need to invest in health infrastructure. We also need to invest in training health professionals, like the midwives, the nurses, and other categories of health workers. And we also need to prioritize policies that will strengthen maternal and newborn health services. We as County Health Team want to reaffirm our commitment in improving the health and well-being for all, especially women and children. So on behalf of the County Health Team, I want to say thank you for inviting us. As I said earlier, we are committed to do what we are called to do, and we will ensure that we deliver to the fullest. Thank you.
Thank you, Dr. Fabio. For those who will be presenting, kindly send your presentations to the email address on the screen, gmartindumois@gmail.com. Thank you. So on behalf of the Superintendent's Council, the chair will call Honorable Bryant, the Superintendent from Nassau County, to make a motion.
Thank you. Superintendent Bryant is the Secretary General of the National Superintendent Council. In the absence of our distinguished and hardworking chair, who is the Superintendent of Liberia County, who is staying in space. The Honorable Minister of Health, Dr. Louis Nkoto, Deputy Ministers, Assistant Ministers, and officials of the Ministry of Health, County Health Officers, my distinguished colleagues, Superintendents of the various counties, who are also chair of the respective county health board, the head of the delegation in Liberia, and representative of international health organizations, representative of international health partners and global health partners, are very huge and committed and loyal health workers around the country. It's a pleasure, not just a pleasure, but a duty and a commitment of a duty for me to stand here on behalf of our current superintendent to just say a few words. Madam Minister, I want to say thank you to you and appreciate for inviting us to attend this very unique occasion. It as a clear manifestation of our own commitment in line with the local government act that makes superintendents and local government authorities to be more functional in the different localities. It's an added responsibility to us, and we are very glad that we joined you in executing that. As head of our respected county health board, Madam Minister, let me say thank you to the crafter of the national health law that made us chair of the board, that have taken us from just being a participant at workshop and seminar to a strategic partner in implementing the different policies and programs. Today, in our counties, our various county health officers and the board are working very closely in making sure that all the responsibilities that are to be executed by the county health team are executed very excellently. We also like to use this time, Madam Minister, that in the Local Government Act of 2018, there are clear responsibilities that are given to the county structures in implementing different programs and reforms in different sectors. As we continue to work with you, we call on the Ministry of Health and the health partners to work with us in executing our portion of that responsibility as enshrined in the LGA 2018. We have no doubt, Madam Minister, that upon your taking over as Minister, the collaboration that you have built with county structures, county administrations, and local government administration in different sectors, in different localities, we have no doubt that this partnership is to be strengthened, this partnership is to remain committed, and we too remain committed, Madam Minister, to do all that we can do to better the lives of our people. As county administration, we always say to our partners in the health sector and other sectors that we are volunteer MAE specialists. We always want to remind you that in our counties, in our cities, in our districts, the different activities and programs that are undertaken by different organizations, let us know, work with us so that we can be that volunteer MAE of specialists to make sure that the programs and activities are executed and you see the work of your money. It is unfortunate that as superintendents, sometimes when we tour our counties, we see projects that were undertaken by previous administration and programs, and some of them really good down for us, and we thought it was that go for all our administration, we want to make sure that we strengthen our relationship, strengthen our partnership, that we all work together to see more our money. We want to say thank you, Madam Minister, for giving us this opportunity. Let me conclude by thanking the Association of the Union of the County Health Officers for electing Montserrat County Health Officer. As we can rest assured that you're going to have a good leadership, you're going to do the best you can do, that you're always done, and you're going to have a very good leadership. Thank you so much for the time.
Thank you, Honorable Superintendent. At this time, we'll now call on the acting representative of WHO for remarks.
Honorable Minister, Dr. Louis Otto, the Deputy Ministers, Assistant Minister Directors, the Chairman of the Superintendent Council, the County Health Officials here today, guest speakers, partners, ladies and gentlemen, good morning. On behalf of the partners, We're very pleased and honored to be invited to be part of this National Health Summit 2025. I am the least qualified person to be speaking on behalf of the partners today because I really arrived in the country on Saturday and my first day of work was on Monday. But then I was told yesterday that I have to come here to speak on behalf of the partners. Of course, I have no other option but to do so. You pardon me if I make mistakes or if I don't get the figures right. But nevertheless, I want to start by commending the government of Liberia under the able leadership of His Excellency and of course our amiable Minister of Health, for taking bold steps to address the health issues in this country. And for me, when I look at the theme of this summit, it is instructive. For me personally as a physician, I always say no woman should ever die while they are giving birth. So for us, for me and for the partner, this is a very, very important meeting where we're trying to look at how to prevent maternal mortality. So, like I said, I commend the efforts of government, and I really want to say that effort has translated into some positive action. We need to recognize that. And what I'm seeing, the figures I saw even before I got here when I was reading about the country profile, I see that we have had some reduction in maternal mortality ratio. It was 10.72. We went down to 7.42, which for me I think is commendable. Skilled work attendance has also increased. It was 61% a few years ago. We are 84 right now, which is very good. When we also look at family planning, we have witnessed some good achievements there. Currently, we have 41% of women of reproductive age having their needs for family planning satisfied. I think this is also commendable. Despite all of this, there are challenges, not only in Liberia, but across Africa. And I just want to highlight one or two of those challenges. Again, our underlying mortality remains an issue. In African tradition, nobody wants to see a child die. I think that is one of the most hard-to-live that ever happened to parents. And we want to ensure that we address, this issue around, child health. Of course, across the sector, we have issues around human resources for health that we need to address, and of course also sustainable financing for health. This is a major issue which, if we don't address, can actually push our people into poverty. So, having said this, we as partners, we just want to make a few calls to action, for government, and also to assure you that as partners, we are with you all the way, and we will continue to be with you. So, the call to action, one, we need to look at more investment in high-impact maternal and newborn health services, especially around antenatal, skill attendant and above. We need to also expand equitable access, to good quality health care. We need to ensure that we protect women and children's rights. This is very important if we are going to reduce maternal child mortality. We also hope to address the underlying social and economic factors that drive inequalities and, of course, health. Because as we know, health is driven by all the social and economic issues, and we want to improve coordination of our efforts. So, as I conclude, on behalf of the partner, I want to, in a special way, I want to thank the President, His Excellency, and of course the First Lady for their commitment. I want to thank the Honorable Minister, who also, by the way, she's the Vice Chair of the Regional Committee for Africa, which is a very important one. So I really want to also thank her very much. By the way, I must also say something about I met her for the first time this morning. When she comes to our regional office, I'm not allowed to move near her because she's up there. So I met her for the first time this morning. And the Honorable Minister, I must say that I was quite impressed at your humility, simplicity, and of course, your warm welcome. And I want to congratulate you as well. And I also want to say that as partners, we are happy to be part of this. We will listen very clearly. We will take notes, and within our own partner group, we will see how we can better support the government of Liberia to achieve its aim. Mindful of the fact that the global development aid is changing, but nevertheless, we are committed and we will be with you all the way. Thank you very much, ladies and gentlemen, and wish you fruitful.
Thank you so much, Dr. Shari. So at this point, we will have a keynote address, and Dr. Moses Masekwe, Country Director for the Clean Health Access Initiative, will present us address. Dr. Masekwe.
Good morning, and thank you. The Honorable Minister of Health, the Chief Medical Officer, Republic of Liberia, and Deputy Minister of Health Services, officials of government present, esteemed and dedicated health professionals, WHO Country Director, and UN agencies, our distinguished partners, hard-working partners, and distinguished ladies and gentlemen. I'm deeply honored to be selected and extended invitation from our Honorable Minister of Health, Dr. Luis M. Porto. Most of all, to stand before such a dedicated gathering of individuals committed to advancing health and well-being of children, women and children around the world, to serve as a keynote speaker on day one of this National Health Summit with the theme titled Unlocking the Potential for Improved Health Outcomes, a Pathway to Maternal and Neonatal Mortality Reduction. It is an honor, and I'm exceedingly happy for the privilege to be the one taking on this task. I consider this not only a challenge, but an opportunity for my long service as a health worker and to some extent as a research scientist in his domain. The minister's choice of selecting me for this important piece of work, I say big thank you and assure you that I will do my utmost to justify the confidence reposed in me. Esteemed government officials, fellow health workers, colleagues, and friends, I'd like to bring greetings from the Clinton Health Access Initiative. The Clinton Health Access Initiative was founded in 2002 and is a non-profit organization in global health committed to saving lives and reducing the burden of disease in low middle-income countries. CHA is an independent entity from the Clinton Foundation. Today, CHA has around about 1,700 employees working in over 35 countries in Africa, Asia, Latin America, and the Caribbean to strengthen health systems. In 2006, CHA was the first international NGO to help Liberia governments rebuild after a devastating long civil war that decimated the health infrastructure and hindered the country's ability to deliver valid health and social services. The partnership with the Ministry of Health evolved from addressing HIV/AIDS to addressing cross-health system challenges, just as since supported the Ministry of Health in strengthening the supply chain management, the health workforce, the health financing, provided technical assistance across various vertical programs, including HIV, reproductive, maternal, neonatal, child, and adolescent health, malaria, cancer, essential medicine, medical oxygen, vaccines, and assistive technology. Child Country Director Dr. Moses Massacre Senior, the humble servant, was appointed by the government of Liberia as the National Ebola Case Manager 2014-2016. It is therefore an honor to address such a dedicated audience on the topic so critical to the future of Liberia. Today we gather to discuss a matter that lies at the heart of our collective humanity, a matter that emphasizes that the health of mothers and newborn is the very foundation of a thriving generation and resilient nation. A matter in inexcusable urgencies that demand immediate and unwavering collective national commitment, the health and well-being of mothers and newborn. Our focus is on unlocking the potential for improved health outcomes with far-reaching implications for our communities and nation. When I received the team and was charged by the minister to speak on this topic, I began to ponder what is left to tell this well-learned audience. Do I bombard them with statistics? Don't they know the problem? Many days know their disease from maternal and neonatal mortality, so they are versed in the matter. Maternal and neonatal mortality in Liberia remains a greater and serious issue. I then realized that the minister herself is a specialist OB/GYN, like many others in this room, is tired of these statistics. The number represent mothers, daughters, sisters, their precious newborn, whose lives who have been saved with timely and high quality interventions. We need to unlock Liberia's potentials towards a logical pathway like never before. So put lives in front of these numbers. On this note, I will certainly disappoint you by stating few numbers, few comparisons, but much more important will be to encourage everyone to get involved, collaborate, support the effort to reduce maternal and neonatal mortality. The 2019-2020 LDHS maternal mortality ratio was reported at 661 per thousand neonatal mortality and 35 per thousand live births. The UNFPA reports as of 2023 post-Liberia maternal mortality at 6.45 per 100,000 births, and neonatal at 34, which is slight improvement compared to the past years. Now let us compare Botswana, for example. The most recent data available of 2023 shows Botswana MMR at 130 to 133 per 100,000 lives, and neonatal mortality 14 to 15 per 1,000. In the region, Ghana maternal mortality is estimated at 308 deaths per 100,000 live births, and the neonatal mortality rate is approximately 22 per 1,000 live births. Whatever the case, it is clear that Liberia still faces high maternal mortality rates compared to global and regional standards. The major causes, if you don't mind, still remains postpartum hemorrhage, anemia, eclampsia, sepsis, complications from unsafe abortion, other barriers like lack of services to healthcare are a big problem. Many women in Europe can't reach health facilities in time. Hats off to the agenda, to the arrest agenda, improving roads, connectivity. It's a critical intervention that ensures timely access to maternal and newborn healthcare services, significantly reducing preventable deaths and complications. Cultural practices might also play a role, such as preferring traditional birth attendants or skilled birth, as we previously listened to the statistics, which is improving in Liberia at 86. Neonatal sepsis, asphyxia, prematurity, low birth rate remain a main cause of neonatal mortality. Of course, poverty is another barrier. Many can afford the services even if they are available. Domestic homegrown solution like the Liberia Health Equity Fund must be fast-tracked. Infrastructure re-engineering is crucial. Building more clinics, especially in rural areas, and ensuring that they have necessary equipment and staff. And ensuring adequate distribution of community health workers is key. Training more midwives and healthcare workers who make a big difference. Also, transportation services like ambulances provided and appropriately used will help in the emergency care of our mothers. Educating the community about the importance of skilled birth attendants and the risk of delivery at home without proper care should always be key on the health promotional agenda. Maybe involving local leaders who help change the delivery practices behavior. Liberia needs strong policies, surely we do have, but the policies must be implemented. Using it as a more transformational approach, empowering communities to take ownership of their own health is key. Over the years, the lack of clear implementation and an acceptable enforcement mechanism has been a major impediment. Most importantly, one such gap is lack of appropriate funding allocation for healthcare, particularly maternal and newborn health. Inadequate subsidies for services to a broader extent, the lack of maternal and neonatal health integration into broader health strategies has been a constant mistake by the service provider. Let me also underline that collaboration between government and national and international NGO is essential. However, this collaboration must be undoubtedly tailored to address the specific needs, the cultural context, the health realities of each community to ensure impactful and sustainable maternal and newborn health outcomes. Let us not forget the private sector can pool resources, expertise to tackle the issue effectively. Partnership, including public-private partnership, must be fostered. Concerting efforts should be placed on this, aiming at mutual and beneficial collaboration to benefit the Liberian people. We must consider the cultural context, which comes with a great deal of sensitivity. For example, integrating traditional birth attendants into the healthcare system by training them to recognize complications and refer cases to healthcare facilities will be and is has been proven to be an effective way and has also economic impact, reducing maternal mortality, obviously, and neonatal mortality can have a benefit for the economy as mothers can care for their families, which demonstrates a logical pathway in reducing poverty and an important area to reducing maternal and neonatal mortality. The role of education of girls, family planning, nutrition also contributes to better health conditions. This is considered an important pathway to reducing maternal and neonatal mortality. Let's finally also look at the potential of the digital world, using mobile apps or telemedicine to reach areas might help in monitoring pregnancies and providing timely interventions. Pathway to reduction can be looked at in many ways. First and foremost, we need to address all existing challenges. I cannot name all, but very sure you know them. We must ensure the government political will. Overall, unlocking our potential is only doable when we adapt a comprehensive approach. One, by strengthening the healthcare infrastructure. Building more clinics, as I said before, especially in rural areas, equipped with necessary resources and with staff, incentivized is crucial. Community engagement, establishing communities about the importance of skilled birth attendants and involving local leaders to foster behavior change, integrating traditional birth attendants into healthcare system through training and enhance the referral system can be done, and it is doable. Success story, we all know there are a lot of success stories, and of course, they have to be documented. That's the only way it can be known. Community-based initiatives have shown that with targeted intervention, maternal and neonatal mortality can be reduced. These successes can demonstrate that change is possible and will inspire us to scale up such action. Strong policies prioritizing maternal and neonatal health must be taken from the shelves, and I can account for that. There's so many good papers breaking, they're all on the shelf. They're not moving from the shelf. And implement with fidelity, leveraging the close collaboration between government, national and international organizations and private sector. Other enabling factor could be, like I said, using the digital to the most that we can apply. And call to action, and a note to all of us is that we all have a role to play, whether through clinical, technical support, resource contribution, or advocacy. We must act now. Let us commit to a brighter future where people are taken from an acute emergency rebuilding mindset that has developed after the war, the Ebola, and the COVID, to a system building and sustaining mindset, because this is the only way we can build a system, a resilient system that will address the issue. And do not, and this is to the county health teams, do not take the ambulance from their assigned places under the pretense of going to Monrovia to collect supply. For God's sake, don't do that. In conclusion, reducing maternal and neonatal mortality in Liberia is not just a medical challenge, but a moral imperative. Government ensuring greater responsibility and having strong political will for action is a sine qua non. There's nothing about it. Let us move forward with hope, determination, collectivity. We can assure that every mother and child in Liberia has the chance to live a healthy and fulfilling life. Thank you.
Thank you so much, Dr. Masaka. So if I took anything from this is all about responsibilities. We all have a role to play, whether it's technical, whether it's resources, administrative, or advocacy. So without much, I will now call on the Honorable Minister of Health, Dr. Louis M. Cotto, for official opening statement.
I think Dr. Masiko has said it. Dr. Masiko, you actually spoke on that. There's, since I took over as Minister of Health, being an OBGYN, maternal and neonatal health, really been on my mind. And I usually tell senior management team that if I leave from this ministry, one mark I want to leave behind is reduction of maternal units. Because if an OBGYN comes in this sector and leaves with high maternal and neonatal mortality, there is no excuse. There is no excuse for that. There is no excuse. Good morning to all. Our distinguished partners, esteemed colleagues, superintendents that are always with us, county health team, guests that we invited, although we did not invite a lot of people, including global, financial, is hitting everybody, so we have to prioritize our priority and just have a few that we will take the message back to them. Good morning. As since we took over, there has been many conferences we have had around the sector. We have had workshops, we have had training, but for me, this is the most important. I say this is the most important because we are talking about mothers and our children. So it's an honor for me to be here, and I take this as a profound responsibility. Today at this conference, we are here to tackle the most urgent challenges in our nation family health landscape, and that is maternal and neonatal mortality. We gather here not only to exchange knowledge and share experiences, but also to reaffirm our collective commitment to saving lives. We view every maternal death as a tragedy and every newborn loss as a future unrealized. I usually speak to the pediatricians that our population is small. And if we keep on having neonatal death, how can we even reach the population of our neighbors? But besides that, that's a life lost. And we have to invest into child health, maternal health to ensure the continuity of this generation, this country called Liberia. Dr. Masiko, just as you said, we have had a lot of plans that's on the shelf, but now we are dusting those plans and making it into realities. You also spoke concerning real-time data. We talk about telehealth. Maybe we have to just let you know. We didn't want to say this, it's a surprise. But to see the partners building that we are renovating, we are dedicating one floor of that partner building to real-time data. We want to get data from the field, real-time data on maternal and neonatal health, and another side will be used for telemedicine. We have spoken with partners and we have secured the funding for that. So we are just waiting. Yesterday I called the contractor. I feel that it's going slow. We need to accelerate that because we have to actually start getting data from the field. You also spoke about, although we're not human resource going to speak, but if we do not have the qualified staff, we will not have maternal and neonatal health reduction. What? Death reduction. We working along with the Bomi Community College to have maternity wing there. That is maternity school, like nursing school for midwives. And we have done some investment. I think they're going to be accredited when we get midwives from Bomi, from the Western Belt, Bomi, Cape Mine, and Bakodo counties where we do not midwives. We have spoken with the family health officer to give 10 persons each, and they will be enrolled in that school once it's accredited, so that you have production of midwives in that area. We noticed that Grand Bassa County had high maternal death, and we spoke with the Southeastern. We have now 10 students within the Southeastern midwifery school that once they complete, they go back to Grand Bassa County to work. And there are lots of things we are doing in human resource that I will keep quiet until the administrator can speak about the human resource aspect. But as we deliberate today, we should be guided by 3 core principles. One is equity. That no woman or child should be left behind, whether it's in the heart of Monrovia or it's in the most remote village. The quality. We talk about health care, building health centers, and sometimes when we talk over, as I went around, I did not know I was even in Liberia, because some of the health facilities that we visited was almost unserviceable that we had to close it down. So the quality, access is not just enough. Everybody talk about the 5 radius, no, the 5 meter radius, but the quality of care. We must ensure that we provide safe, respectful, and high quality care. Accountability. We must set clear targets. We should measure our results and hold ourselves accountable at every level. To our partners, we ask for your continuous support, not just in resources, but technical assistance. Help us with some innovation and solidarity. To our national leaders and county health team, we want to say thank you. Since you took over, you have been doing extremely well. But again, we ask for your unrelenting commitment to strengthening the primary health system and ensuring that maternal and neonatal health remains a national priority. To my team, the CMO, the DMP, the DMA, Controller, Assistant Minister, I want to say thank you. You have been tolerant, I may say, because as I push you all to the extreme, there hasn't been a time that you have never seen reason what we have done. Last year was challenging, and now this year it's time for us to implement and move faster. In closing, to all of us, together we will build Liberia where no woman dies while giving birth, and every newborn is welcome into a world of hope and health. Let us all think Liberia, love Liberia, and build Liberia.
Thank you, Honorable Minister. So at this point, we've come to the close of the official opening program. We will now move to the group photo. Martin, where were we? So we'll be outside. But before we go, for those who've not submitted, who've not emailed their presentations, kindly do so. So the email is gmartindumoe@gmail.com. So we'll now move outside for the group photos and then we will resume after that.